So I knock on the door, walk in, introduce myself. My name is Tom Krazak. I'm a senior at the University of Manitoba. Today I'm just going to section your trach and change your dressing. I'm doing a safety check as I walk in. I see the patient's not in any distress. There's nothing on the floor and there's no hazards or anything. Perform hand hygiene. Now I'm just going to check the oxygen, and it's ordered at 45% humidity, which it's at, and it would be at 10 liters of oxygen. But I'm going to turn that off for the sake of the demo, and I'm going to make sure that there's water in the cold pot. Next, I'm going to check the pressure. It should be between, or the suction, it should be between 80 and 120 millimeters of mercury, but it's not working in the lab here, so in real life I just make sure it's between 80 and 120. Now I'm just going to make sure I have everything I need beside bedside, or by the bedside. I have my manometer here, and I'd be using it if I was just checking the pressure in the inflator in the ball in the trach, which I'm not doing right now. And I'm making sure I have normal saline here just for the dressing change, and I have sterile water just to clean the suction after suctioning the trach. Just gonna run through the box here. I have, actually I'm just gonna raise the bed first. Okay. So the anchor, if the patient wants to suction, I have a trach dilator in case something goes wrong and we have to dilate the trach, which won't be happening. This is a new tracheostomy tube if needed, and then I have this is an oxygen supply tube if I was going to use the ambu bag, which I'm not. What else do I have? Some cotton swabs. I have some straps, some Velcro straps if we're changing the trach, which we're not. And then I have another manometer here. Another cannula, but this isn't the right size, so I won't be using this. And then a Christmas tree, again, for if I was using the ambu bag, which I'm not. So I'm going to start by suctioning. So first off, I'm going to grab a pair of gloves, and I'm going to grab the correct suction tube here, and to choose the right size, I would take I would subtract 2 from the inner cannula, which is a size 7 French. So subtract 2 is 5, times 2 is 10. So it's 10 French, so this is the right catheter. I'm going to ask the patient to take a few deep breaths beforehand. I'm going to take this off. And make sure this doesn't fall off. And then I'm going to perform some hand hygiene here, and then put some gloves on. And this wouldn't be open. I'd open it. Again, make sure that the suction is on and it's between 80 and 120. And then I take the glove off here, attach, and then I will keep the tip sterile here. I'd have a garbage here, and then I can touch this about 5 to 6 inches from the tip, and when I insert this, I'm going to make sure I'm not touching anything on the exterior of the trach, and I'm going to go until I feel resistance, and then I'm going to start suctioning. Again, before doing this, I'd make sure that I had an O2 sat, or I'd be measuring the patient's O2 sats. Make sure they don't drop, and again, like I mentioned before, that I asked them to take a few deep breaths just so they can saturate themselves. So then I'd insert this until I feel pressure, and then I'd suction intermittently, and I'd rotate for about 15 seconds, again keeping my eye on the O2 sats and stuff. That's done. I'd remove it, and then I would somehow wrap my glove around this, take this off, chuck it in the garbage here, and then I would section out all the sputum and stuff in some sterile water just for a little bit, and then I'd wrap this up again. Put this over here. I'd wrap this up again in a clean glove and put it back. Alright, so now in the meantime I can reattach this just so my patient can get some humidified oxygen, and I'm going to grab my sterile field, which I opened before. Alright, so I perform hand hygiene. Next I grab my inner cannula. I need a size 7, which the patient has in already. I have here, it's the same color. So it's the correct one. So that's the first thing I'm going to be doing. I'm going to be replacing the inner cannula. So I'd remove this. Keep this here. Perform hand hygiene. Put my gloves on. I'd probably put my gloves on first before removing that. Just so my patient could have some humidified oxygen for the longest time. Then I would remove this first, drop it, open this, and this has to remain sterile, but I can touch the outer part of the inner cannula, so I'm actually going to use my sterile forceps to grab it out of the container, and then grab the outside of this, and then these would be garbage since I touched them. This needs some practice, but put it in at an angle, make sure it's in there. I would stabilize before doing that instead of just making it move around like that. That was pretty bad. And then I would take the old dressing off since I'm here, and then I'd assess it. I'd see that there's some drainage. Other than that, it looks pretty healthy. So now I'm going to go ahead and start cleaning. So I'm going to change these gloves, perform hand hygiene, put on another pair of gloves. Obviously not those are used. I would use these. I would grab a new pair of forceps because those are contaminated, but for the sake of the demo, I'm just going to keep going here. So I'm not going to use this, or this. And to start, I'm just going to use these cotton tip applicators and a moistened normal saline. I don't have normal saline in my tray right now, but in practice I would. Make sure it's kind of dried off there. Then I do one swipe on the bottom. Take another one, put it on the saline, go to the side over here into the top, drop, take a third one, normal saline, this side, and then to the top. That's clean, and then I'm gonna go with some 2x2s and clean on the bottom of the trach and the top of the trach as well. Dab a normal saline, dry, and that came apart. Obviously this would be a lot better. One side down there. Second one here. Saline, dry, and then I'd ask a second nurse to open this up here. Do one more swipe, drop, and then I dry. So again, 2x2. One swipe on the bottom there. Oop. Take that with me. second one here. Clean the top or dry the top. Open this up a little bit. Dry the top. And then I'd be able to put my drain tube dressing on. So I would.
Now what I will do is I will take off the old gloves, do hand hygiene, and grab the.
This needs a lot more practice.
So by just my knowledge, I know that the size 7 fake cream is in place.
Pull this through.
I know that I need a
These
size
aren't
10
sterile anymore, then I can pull these through.
suction catheter.
And
So now what
that's good, it's on. One thing I did assess the stoma beforehand, but I would have done a better job of assessing it after I cleaned the stoma. I forgot to do that. Other than that, I put this back on here.
tell them to take 2 to 3
Give my patient some
breaths for like
oxygen.
about 30 seconds. Okay.
Make sure that the oxygen is on 10 liters as ordered by the physician. Sure that's on there. And then I'd clean up, I'd lower the bed. I make sure to document how the patient tolerated the procedure. And then I document the state of the stoma, how clean it was, the drainage and whatnot. And I do another safety check as I leave. And that's it.